Hi, do you have what is commonly called a waist pain, a low back pain? In this video, I'm going to offer you a series of exercises, self-massages, and stretches for its treatment, management, to reduce or even eliminate these pains. But first of all, it's important that you understand what low back pain is and, above all, what causes it. Low back pain is the one that occurs in the last lumbar vertebra, sacroiliac area, and a very, very mobile area. We could say hypermobile, too mobile in modern humans, not in humans. In modern humans, why? Because modern humans spend many hours sitting. Because modern humans are subjected to a lot of stress. Because modern humans do not exercise. Because modern humans have digestive, intestinal disorders. Because modern humans exhaust and stress their kidneys, kidney organs. All these things that I have told you, which are present in almost all humans in the modern world, cause stiffness in the upper and middle lumbar area. This always causes that when there is an upper and middle lumbar area that is stiff with little movement, obviously, someone has to do the dynamic work, someone has to do the movement that these two areas do not perform. Who does their work and their neighbors? That lower lumbar area, which we said is hypermobile, always pays the consequences of someone who doesn't want to work. As so many times, the solution, the treatment, is not so much in the area of pain as in working on neighboring areas, hypermobile areas, areas that move little. With this understood, understanding what causes low back pain, waist pain, we are going to explain what we are going to try with these exercises. Obviously, mobilize, remove stiffness from this hypermobile area, the middle lumbar area, lower lumbar area. And we will do it with some exercises that I'm going to name first, and then we can do them together, one by one. First, an exercise for the low dorsal kyphosis, a fantastic, fabulous exercise, an exercise specific to the modern human world. This is anti-sedentary. This exercise is fantastic to do every day when you come back from work, from your office, your car, the place where you spend all those hours sitting. Second, a combined stretching of the psoas and hamstrings, especially due to the stretching that we are going to do in this case of the psoas, a muscle that pulls this lumbar area forward. A reprogramming exercise for the lower back to restore tone, that contractile capacity. Reminding these lower back muscles that they can contract, muscles that in the position of low dorsal kyphosis have lost that contractile capacity. They remain stiff to maintain that area in kyphosis. Here we are going to remind them that they can contract by making lordosis. We are going to do a relaxation exercise for the lower back with balls, aimed in this case at opening this lower lumbar area. A strengthening exercise for the lower back using a crossed pattern. A wonderful self-massage of the glutes, very suitable for these pains in the sacroiliac area that also have a lot to do with the glutes, piriformis. A self-massage of the lower back with a stick to relax the quadratus lumborum and all this musculature of the lumbar mass. And an exercise to release tension through tapping on the lower back, which will also help to restore the capacity of that area to expand and relax. This is something that a stiff area needs. A stiff area has contracted, but has not remembered to relax. It has been so static for so long, so contracted that it no longer remembers what the duality of contracting and relaxing, typical of dynamic things, is. Dynamism is this: I contract, I relax. A static area is a chronically contracted area that no longer knows how to fluctuate between contraction and relaxation. It is an area that is too strong, so strong that it no longer knows how to relax. With this exercise, we are going to help the lower back to loosen up, to relax. Of course, accompanied by all the other exercises that you and I are going to do together, one by one. This exercise has two keys. The first is to place the support point of the back in the right place. I'm going to tell you how to find it, the mouth of the stomach. If we traced a line back, that's the point where we should lean against the edge of the table. Let's see how it's done. She is going to lean on her hands, lower her entire back, and lean just the back on that point behind the mouth of the stomach, right on the edge of the table where you will have placed a towel or something soft so as not to hurt yourself. From there, the second key is to raise the arms to one side and let the pelvis drop to the other, so that we arch the entire back. Two important points. 1. Try not to make the pelvis tilt forward too much, by making a small pelvic tilt backward, and then letting it drop without anteversion. And the second point, once we have finished after 1 or 2 minutes, instead of lifting up by arching forward, we again tilt the weight. We tilt, and then we straighten up with our elbows. To perform this exercise, we're going to tie a belt, any belt, to the leg of a table at a length that you'll need to adjust to find the right tension on the chain above. Then, using a second belt, we're going to tie it around the front part of the foot at the toe pads. We'll bend the knee towards the chest and lie down to protect the lumbar area during the movement. Once that's done, we'll introduce tension into the hamstring. We'll lower the toes towards us, thereby tensing the entire posterior chain of the upper leg and the entire anterior chain of the lower leg. We must always protect the lumbar area by bringing the leg as close to the chest as possible, causing the pelvis to rotate into retroversion and the lumbar area to stay well stuck. It's a fantastic, wonderful, and complete stretch. To perform this exercise, we'll either sit or lie down and perform short, small contractions as follows: contract and relax, contract and relax, contract and relax, contract and relax. Sets of 30 to 40 very short repetitions, lasting 1 second each, with small rests in between. It's a great exercise for toning the lower back muscles and can be done while sitting in the office, sitting in the car, or anywhere to keep the muscles active. To perform this exercise, lie down with a foam ball, like a partially deflated rubber ball, placed underneath your pelvis in the area where you feel it encourages your lower back to stick. If you place it too high up on the lumbar region, it won't work, and if it's too low, you won't feel much support. You have to find the right spot and let it fall. From there, it's simply a matter of breathing for 2 to 4 minutes while focusing on letting the weight fall and flattening the lower back. Every time you exhale, let the weight fall, the lower back will flatten, the pelvis will tilt, and the hips will relax. To perform this self-massage, we will use a hard rubber ball, like this tennis ball, which we will place here in the gluteal area to work all the muscles of the hip, superficial and deep, including the piriformis, Gemini, obturator, gluteus medius, gluteus minimus, and even the tensor fasciae latae on the lateral side. To do this, we will lie down on the floor, on a mat, face up, and place the ball in the gluteal area. We choose any point because we will be able to move the ball at any time, and we will perform gentle, slow, deep left-right movements, releasing the breath, releasing the pain through the mouth, and releasing that tension. We change the position of the ball and can move it around. We can change the position of our leg, straighten it, bend it more, move it out, or let it fall to vary the way we work on the gluteal area. After 4, 5, 6, 7 minutes, we place ourselves more and more sideways and work on more lateral areas, a little higher, a little lower, but the entire lateral area until we even place ourselves completely sideways, even downward, to work on that tensor fasciae latae. Once the self-massage is done, after 5 or 10 minutes, you lie down face up, stretch your legs, and feel the most magnificent sensations that this self-massage will have left you. We are going to perform this self-massage using a stick like this one. As you can see, it's a pretty thick stick. A thin broomstick won't do. It has to be at least from some tool in the field. Thick sticks so that it's not too incisive. Let's see the maneuvers. Initially, we can do a maneuver starting from the top, going down bilaterally on both sides of the lumbar region. From the top, we go down, up and down towards the bottom. I put a little bit of oil on it so it slides just enough so it doesn't hurt my skin, but not too much so it slides too much. Do you see how it adheres to the skin? It's attached to the stick, but if I apply more pressure, it slides. That's where we'll do the second type of maneuver. We start from the top on one side. You'll do this on both sides, but let's see it now on one side. Do you see that I'm going from inside to outside and at the same time going down? I can go in the lowest area, do only the outward movement, and gradually bring the stick further forward, and little by little, we repeat that maneuver, each time a little higher, and work and deepen the entire lumbar area. To perform this exercise, you will simply lie down on a mat, carpet, or a somewhat soft surface. Without further ado, you will lift your pelvis slightly, very slightly, and you will hit, but not just once. Rather you will do it with a frequency. As you do it, you have to perceive and leave your perineum, all the muscles of the anus, the belly relaxed, maintain a fluid breath, and feel how each beating makes your pelvis vibrate, leaving it relaxed at the same time. 1, 2, 3 minutes, and then you perceive the wonderful sensations that will remain in your lower back, pelvis, and even your legs. Well, I hope this compilation has been of interest to you. I hope it helps you improve your problem, and I encourage you in any way to search and find another bunch of videos with exercises, self-massages, advice. All that here on OnSalus Health.